Okay, this is our first virtual, we'll say boot camp because that's kind of what it says, skincare boot camp. So we've all been through this COVID experience over the last year, and it's really forced us all to think outside the box. So that's why we're doing this virtual event for everyone. I'm sure you're concerned as to why we don't have on our masks and why we're sitting so close. But both of us have been vaccinated. So the CDC says if you're in company with a fully vaccinated person, you do not have to social distance or wear your mask. So that's up. So mask off, get vaccinated so you get masked off. So let's see, down to business though now. So I know you guys are here about this boot camp skincare. So we're just going to get on down to talking about what you're here for. So our skin and aging. So everyone comes in and says, I just don't look myself anymore. No, we don't look ourselves anymore.
I don't recognize myself in the mirror.
That's it. Or I'm looking like my mother in the mirror, and I love my mother. But yes, that's what we do. We look like our mother. So what you can see is that this is a mother-daughter. That is actually me on the left or right to you, and my daughter on the left. I'm sure you know which one is my daughter, which one is me. My daughter's in her 20s. I'm in my 50s. So you can see the difference yourself, but I'm going to point out a few things, and Nicole's going to let me share with you some of the things that's different between myself and Brooklyn. So take a look underneath my eyes. You can see those fine lines and wrinkles. So I have many more than Brooklyn, but you do notice that Brooklyn has started forming some of those. So remember, in your 20s, you do start forming those lines, okay? And so you can also look at my neck and see the texture of my neck and those fine lines that are in my neck. If you look at the corner of my mouth, you can see some of that jowling that I have that Brooklyn doesn't have. Also, that crease between our nose and our mouth that everyone hates, that's called our nasal labial fold. That comes from skin elasticity loss, which means our collagen has decreased over time. And it starts actually as early as our 20s. So as we have collagen decrease, we also may not lose fat anywhere else on our body, but we lose fat in our face. So that gives us some flattening effect. We also, our bones start to thin. So our jawline takes on a little different frame. Our skin, the laxity comes from the loss of collagen, as we talked about. And fat, all of those things.
Skin texture,
all of that's from what's happened to us as we age. Our sun exposure, tobacco usage, alcohol usage, lack of sleep, our poor diet,
lack of exercise, and hydration.
Most of us don't drink. So what we're going to talk about is how we can improve that before you get any type of procedures. So what we can do to improve our skin care and just good skin care in general, not necessarily just the products that you have to use, but what we need to do for prevention. So I'm going to turn it over to Nicole, and she's going to talk about what we will do at different decades in our life.
So when I was in my 20s, my skincare was completely different. I fell asleep in my makeup. I could use drugstore cleanser, and I was in the sun. I maybe put sunscreen on quickly. It wasn't a big deal. I wasn't thinking too much about my skin at that time. But really, it's important to start preventative care in your 20s, because as Dr. Owens said, that's when you start even losing your collagen as early as your 20s. So I know there's thousands of skincare products, and if you're like me, I'm constantly on, looking at the websites. I look at all our products, and I sometimes get overwhelmed in where to even start. In your 20s, keep it simple. A really good facial cleanser. Definitely make sure you take your makeup off at night. In the morning, just a good moisturizer. Even if you have some acne, oily skin, they say that even with oily skin, you still need a good moisturizer. And then sunscreen is, as Dr. Owens will tell you all the time, so important, the most important. So that's, in your 20s, simple. As I got to my 30s, my skin changed. I had probably some hormonal changes. Skin got a lot more dry. So that's where we add our vitamin C serum during the day, and that helps with free radicals, environmental things like Dr. Owens was talking about, sun exposure, all that brightens your complexion, helps with the texture, and fights. It's like an antioxidant, like a probiotic. I was telling Dr. Owens earlier, it's like a probiotic for your skin. So vitamin C serum is probably something you want to start in your 30s. Again, a good moisturizer, and then of course sunscreen. And then at night, you might want to add a tretinool or a retinol serum, which we have a really good one here. And that helps with fine lines, texture. That's another vitamin A, so another antioxidant. And that helps with a little bit of fine lines that you'll start getting in your 30s, and prevents all of that. And then a good moisturizer as well at night. as I'm getting a little bit closer to 40, which I'd love to not admit, but as I get closer to 40, I'm starting to use a little bit more of a gentler cleanser, maybe something with a hyaluronic acid in it that helps with moisture, because that will bring in the moisture of your skin. Again, vitamin C serum is super important in the morning. Definitely that moisturizer and that sunscreen. So everything that you did in your 30s, probably adding maybe a little of the lifting serum or probably a thicker moisturizer at this point at night. But how has your skincare changed?
Well, so I was one of those young girls in the 20s that didn't take my makeup off either. And then when I got to med school and started delivering babies in residency, I never wanted to be without my makeup. So I slept in my makeup, would get up in the middle of the night, brush my teeth, make sure I had my lipstick on. And, you know, at the time, I never felt anything bad. I thought, oh, wow, this is really great. Well, recently I've understood that if you sleep in one night of makeup, it can age your skin by 7 years. And oh my goodness. So when I look at Brooklyn's skin, and I think about what her skin looks like, my skin was that supple and that full at that point. And with everything that I have to do now, considering I didn't do anything earlier, if I would have started earlier, I could do a lot less at this point. So great big game changers for me as far as skincare. You can see that this skincare is our own skincare. It's called the Real OG. We actually formulated this with dermatologists and looked at our climate in Louisiana to see how this skincare would best fit what goes on here. And I can tell you that the cleanser, the vitamin C, the ultra lifting serum, that actually adds plumpness to your face. And after using it for about 2 weeks, you can see a 30% increase in fullness in your face. And that's what I've seen. I have people every day tell me, oh, wow, your skin's so beautiful. I'd never know that you're in your 50s. I really appreciate them telling me that. I tell them all my secrets. I don't hold anything back because I do have to have a skincare regimen now. I do have to wash my face in the morning and at nighttime. I do have to put on my vitamin C in the morning. I do my sunscreen. I do all of those things now that I didn't do earlier, but I, for sure, after using my skincare, can see a great difference in my skin. There's other things here that we're going to talk about that we do that have really added to my skin. One little thing that I will throw in there is don't ever think that it's too late to change your skin, because we'll never stop the hands of time, but we can slowly slow it down. So that's the most important thing, to fight it. So these are some of our preventions, and you see some things on here that we've already talked about. Your skincare regimen, regardless of whatever other medical procedures that you do, surgical procedures, you can never not continue your skincare regimen. You've made a great investment in your skin doing those procedures. You've got to back up and protect that investment with your skincare regimen, okay? So Botox. So speaking of Botox, Botox was the second largest growing cosmetic procedure done during the pandemic.
That's crazy.
It was crazy enough to me too.
Yeah.
We were so busy and I was needing it so terribly. And, you know, I finally realized we all had on those masks. All you could see were our eyes. We were all on Zoom calls at times, so you could see yourself looking down. You were trying to make more expressions with your face because people couldn't see your smile. So in doing that, you had more muscle movements. That skin was starting to just stick over those lines and form those fine lines and wrinkles. And at the end of the day, when you pull off that mask, you could really see what was going on. So I really think that's why the Botox treatments have really, really gone off the chart. And they're truly great. Prevention, they're definitely great. So I've started Brooklyn on a little bit of it. She had a bad forehead line that she was born with, so I gave it to her there. I haven't done too much around her eyes, but I will tell you where I get Botox. And that's around my eyes for sure, in my number 11s that we'll see on another little preview as to what all else we can do. There's Botox can go anywhere on your face and other places. So these are some of the preventions. We'll go into more detail about a hydrofacial that we offer here. That's a medical facial. As far as our chemical peels, we've already touched on the retinol. So let's just kind of keep moving forward, and we'll save our questions to the end. So please chat in any questions that you have and we'll address those at the end, okay?
So here's our Botox.
So here's our Botox that we talked about, right? All of this is treatments for wrinkles. Those other things that we talked about prior to this time can be started at any age to help prevention. But if you're like me and you don't start soon enough, this is how we treat what's going on with our face. So this next slide is going to show you a little about some Botox, a little about some filler threads, some injectable fillers that we have, and also some lifting threads. We'll go into a little bit more detail about that. So as we spoke about, the common, just remember this, when a lady comes in for Botox, she will come in and say, this number 11 line really, really bothers me, okay? So I'll tell her that takes 20 units of Botox. I will tell you, once you relax those muscles though, your other muscles are going to take over and may cause more wrinkles in that area because of your expressions. And so you may eventually need Botox there. Most women in their 30s all the way up really need Botox in their number 11 line, which is their glabellar, some in their forehead line, and around their crow's feet, okay? So if you come in and I tell you what I think is best for you, if you're asking my opinion, most women in their 30s to 40s need 40 to 50 units of Botox to start off with, okay? So that's where you need to be thinking. And if we tell you that, it's not for you to spend your money, it's for you to get that look that you're looking for when you walk out of the office. The greatest other thing that we've introduced recently are some filler threads. So for those of you, and like me, that didn't start Botox soon enough, and we already have fine lines in our face, Botox cannot take care of those lines that you have in your face at rest. So you need something in addition to Botox. So you need your Botox and your filler threads. Filler threads are simply the suture that we use to sew in surgery. So it's nothing that your body is going to have a reaction to. It's like a fine strand of hair that goes in right underneath the skin. As it dissolves, it stimulates collagen over time and helps fill in those fine lines and wrinkles.
You do mine right here, and I love it. I totally see a difference because my little marionette lines are getting heavier as I get older. And I've noticed when I do those lifting threads or those filler threads, I'm getting more plump and I'm getting more radiance back in my skin.
Absolutely. And that, as she says, that stimulates her own collagen. But occasionally women come in, they say, I want even more, I really have to get these lines taken care of. So when that's the case, then we do fillers. So fillers add plumpness to your skin. We can put them in your cheeks to enhance your cheeks. We can put them underneath your eyes to help with dark circles. We can put them in your lips. We can put them along your jawline to give you more definition of your jawline. We can also put them in your nasolabial folds if we feel at that point that that's going to give you the best look.
What is our next thing we're going to talk about?
So all of these things that you can see, say they stimulate collagen or they augment your own collagen. So the next thing that we'll talk about will be the skin pin. And the skin pin is known to most people as a microneedling. So that's actually what it is. It's tiny needles that you're numb, so you don't feel those, but they go all over your face to make like little injuries in your skin. But like I say, they're micro injuries. Your skin's natural process is to stimulate collagen to take care of an injury. And that's how it helps with old scars, acne scars, chickenpox scars, fine lines and wrinkles. I've done skin pin in the past or microneedling, and I absolutely love it. So in doing that, that also stimulates your collagen. I think you've done some skin pin or you haven't had to do it as of yet.
Right. This is my next procedure I really want to do. As soon as I can get in with Rhonda, this is my next one.
Our esthetician really stays booked because the other thing that we do with our microneedling is something that you've probably heard called PRP, and that's just protein-rich plasma. It has a lot of growth factors in it. The greatest thing about that is that's derived directly from your skin, so it's nothing that's your body won't recognize and react abnormally to. It actually enhances your skin pin. So it throws in those growth factors. So as you're stimulating collagen, it helps add back even more plumpness and more ability for your collagen to be stimulated. So ask for microneedling with the PRP.
I've had some patients come tell me after this, they find the results almost similar to Botox. So they love this with, sometimes some of them do with Botox, but they love the results of the skin pin.
Yeah, love the results. It gives you at first like a mild sunburn appearance. So we tell everybody, if you are thinking about doing some kind of procedure for your face, make sure that you have a 2-week window before you have to have pictures or a big event. Of course, you can go back to work, and now, especially with you wearing the mask, you can cover up any maybe bruises. That's right. It's the one good thing. Any bruises, on your face, if you may have those, but at least that gives you that. So if you're thinking about anything, make sure you give yourself that 2-week window. So we can move on to Thermi Smooth. So tell them what you think Thermi Smooth is like.
So I've had ThermoSmooth done and I love it. I know it's necessary to build collagen and it's helping my skin, but it's so relaxing. It's like a warm stone massage around my eyes and in my mesiolabial folds. Builds collagen again. It's a little bit less invasive than the microneedling or the skin pen, but it helps build your own collagen. And it's so relaxing.
So it's so relaxing. What I will tell you, a lot of these things that we're telling you build collagen. So it's really very important for you to come in for your own personal consultation, because all of these different procedures stimulate collagen, they're not all good for everybody. So it has to be individualized for you, because if I think that you have too many fine lines and wrinkles, then ThermoSmooth may not be the first thing that I think that you need to do. So I love that people are interested in all these different things that we do, but just realize that when you come in, we're actually going to individualize the treatment that we think is going to give you the best results.
So this is our skin treatment for discoloration. So I think what we were talking about earlier is that people come in the most, women come in the most with, you know, texture issues, fine lines, and then discoloration is a big one that we see.
A big, you know, most people are concerned about the discoloration underneath their eyes. And then I explain that to them is that that's not really a pigment issue that a chemical peel will help. That's more loss of fatty tissue. You have more thinning of the skin. So those blood vessels are seen. So when the light reflexes there, you actually see those darker circles underneath your eyes. A lot of that can be from lack of sleep. A lot of it's hereditary. So there's different things that we can do as far as injecting fillers underneath there, injecting PRP to stimulate your own skin growth and collagen that will help that area be more plump. But a chemical peel, if I had to tell you what a game changer for my skin is, I would tell you it's the chemical peel. What the chemical peel has done for me, it has definitely made my pores smaller. When your pores are smaller, it definitely makes your skin look more smooth. Mm-hmm. It's added more brilliance to my skin. It's definitely helped with fine lines and wrinkles and some discoloration. Nicole mentioned earlier, we were talking about patients and hormones and, you know, how sun exposure can worsen our discolorations that we have. This chemical peel is what you need. Because it says it's a chemical, don't be so worried and standoffish with that, because our esthetician Rhonda knows exactly which chemical to put on your face. At worst case scenario, for me, I've had some mild peeling. They tell you about those type of things. They tell you what your post-chemical peel treatment is, and really, really stick to that regimen, and your issues with peeling will definitely be significantly decreased. But the bang for your buck that you get for these chemical peels is out of this world. They're recommended to do monthly. If you have issues with acne, our esthetician may recommend that you do it more often. So it really just depends on what's going on with you, but it helps people with rosacea, acne, fine lines and wrinkles, discoloration. I mean, it is a wonderful procedure to do.
Good exfoliator, helps with the texture of your skin. It's, like you said, a game changer.
Absolutely.
For sure.
So this is our hydrofacial. So our hydrofacial, as we spoke with, is also will help with exfoliating your skin, help with that clarity of your skin. We talk about game changers. Me being in my 50s, what I think has done the most for my skin would be a combination of what's called a dermaplane, and that's really a manual exfoliation where they take off the very top layer, not painfully, of those dead skin cells, and then they follow it up with a hydrofacial, which is a medical facial and relaxing, but what it does for your skin, it cleanses your skin, it unclogs your pores, it puts growth factors and stimulates back into your skin, and the shine and the smoothness that you get out of after hydrofacial is amazing. Amazing.
You can
truly
always
amazing.
see the patient that came out after a hydrofacial when they're at checkout, because they look like they just walked. I mean, they look, their skin glows like they just came out.
Truly glows. And this, along with the chemical peels, definitely helps change that skin texture that as we age, most of us do not like. So the laser treatment. I'm sure most of you have heard about a laser treatment with hair removal, and yes, we do that as well, but it also helps with those discolorations. I don't know if you can see it now, but it's almost completely gone. I had like a little liver spot on my hand. I have some on my legs. When you get some laser treatments, of course, you have to stay out of the sun for a while. It may take 1 or 2 of those laser treatments, but it's amazing with how it resolves. So things like vitamin C won't necessarily take care of those because they're so deep. So you need a little bit more intensive treatment with laser. And I think you've done some laser as well,
Yeah,
right?
so I had some hyperpigmentation again. I think it was hormones right on my face. I had Rhonda take care of that, 2 treatments, and it's barely there. And it was getting darker, it was bothering me. It was like every time I put my makeup on, I just kept seeing this dark spot, and the laser treatment took care of it. So.
And it also rejuvenates your face. So I'll also do it. We were talking earlier about our skincare regimen and where we should use it. So all of us think about our face. None of us like our neck, and most of us don't like our hands. So those areas should be treated just like your face at daytime and nighttime. Whatever you do to your face, you should take it down to your décolleté as well as your hands. Think, we're all covered up. When you're looking at me right now, what do you see? My face, my décolleté, and my hands. Driving down the road, this is what it gets it. I mean, it can be 40 degrees outside. If the sun is shining, you will get a sunburn in this area. These are all those lines that we don't like in that. So laser helps, those filler threads help in that area. So there's a lot of, we have tons of
Many things.
methods to help with everything that's going on with us that we don't like.
What did we say? You shouldn't treat the flower without treating the stem.
Exactly right. This is the flower. It cannot have an ugly stem. Remember I was talking about those necklace lines? Those little filler threads go right underneath. And then as they dissolve, they stimulate collagen. Your platysmus muscles, when you do this, that stimulates all those necklines. People always say, why do I get this? Think about what you've been doing for the last year. Looking down, looking in this, straining here, straining there. So all of that skin movement creates those lines because those muscles, just like muscles anywhere else on your face, are constantly contracting. And as they contract, they bring that skin down over those areas. So just remember to treat all these 3 areas the same.
And sunscreen.
And sunscreen. Okay, so I know we've been through a lot of information. We tried to make this as informal as possible, but as informative as possible. So I see a few questions in our chat box, so I'm going to give you time to send in a few more questions and we'll answer as many as we can. So Nicole, do you see those questions?
No,
I can't see. I'll have to put on my glasses to see.
Okay, let's see. I have any questions? So one question I see is, how often do you recommend doing Botox?
So the Botox treatment itself, let's talk about that 2-week window, okay? So you should come in, have your consultation. We talk about how much Botox you need. We do your Botox that day. I tell everyone what they shouldn't do after that treatment. As far as your Botox will start showing as early as 3 days, your maximum results are 2 weeks. And by 3 months, that muscle has the weakness that it had from the Botox is usually out. That muscle is starting that contraction again. So it's really important to get your Botox 3 months, every 3 months. Some women space it out to every 4 months, but if you want to get your biggest bang for your buck, because as you continue to decrease the strength of those contractions in those muscles, you may need even less Botox next time.
And then let's see the next. Do the PDO threads lift the skin also?
Yes, so PDO threads, there's 2 different types of threads. You'll hear us talk about the solid filler threads. Those are the ones that help with those fine lines and stimulate your own collagen. And then you'll hear us talk about those lifting threads. So the lifting threads are made out of the same exact material. It's called polydioxone, PDO. And like I said, it's what we use in surgery every day. Those have little barbs on them. So as you introduce that little thread right underneath the skin, so for instance, if you're talking about the nasolabial folds, then you introduce those threads right underneath the skin. And then when you pull, you'll see the pull that you get with those threads. So you can have a 3-vector lift this way. If you're worried about some jowling and you want to tighten up your jawline, then you can have 2 threads here that go down there to help lift up your jawline. So that's actually what the lifting thread does. It's a little in-office procedure. There's minimal to no downtime. You'll actually see the lift after you have it done that day, and it will continue to improve over time.
So does the hydrofacial leave any discoloration when done?
I personally haven't noticed any discoloration when done. If you have a certain treatment regimen that's done with your hydrofacial at the time, it may bring that discoloration up to the surface, which is actually good because your skin cycles every 28 days and you will naturally slough off your own skin. So discoloration after a hydrofacial is not necessarily a bad thing.
I mean, I might get a little pink, a little red, but no discoloration after.
Correct, correct.
What can I do for my smoker's lines?
Okay, so number one thing is come in and we'll help you stop smoking. That's to help you with, that's most important. And then after that, so we can do Botox in those smokers lines that will help that muscle relax a little bit. And I tell everyone, if you're someone that's a public speaker, which means if you have to do, if you have to do speaking on a daily basis for your job, that may inhibit that some. It's not terrible. You can't drink through a straw right at first because it does paralyze some of those muscles, but no one else will notice that other than you. You just can't do this, which you don't want to do because that's what continues to form those lines. So yes, you can do that. We can also do some of those filler threads that will stimulate, and even some fine fillers themselves help with those smoker lines.
I helped her quit.
Do what?
So she said, I helped her quit. Yay!
Yay!
How often do you recommend getting threads?
Okay, so threads, that's a great question. So this is what I tell patients. So those threads, those little filling threads, they come in a packet of 5. So usually each area that I do needs 1 to 2 packs, okay? Those threads are $100 a pack. They dissolve completely by 3 months, but within a 8-week window, you come back and I can see what results that you've had for those to see if I need to give you additional threads at that time.
So I think we have one more question. Oh, hold on. How old would you say you should start Botox?
So once again, we're talking about if you're doing Botox for prevention. As early as your 20s, I would say you should start Botox because you're smiling, you're squinting, you're doing all those facial movements. That Botox will help decrease the muscle activity, the strength of those muscles. So if you started early on, you will decrease having to do everything else that I have to do at this age, which are those fillers, those filler threads, some more intensive like Thermi Smooth is great around the eyes and around the mouth for small fine lines and wrinkles, which are most probably from life expansion of using my face, sun. I wasn't a smoker, thank goodness I didn't have that, but lack of sleep, lack of hydration, all those things that you guys do, I do as well. So if you'll start early on in your 20s, it will decrease, and all those other things that we talked about as far as improving your skin, you will have to do less as you age. You come in the office, get your complimentary consultation with our esthetician or with myself or Nicole or Candace, Dr. Gonzalez, any of us, so we can tell you exactly what you need that's going to get you the face that you're looking for.